DNA, short for deoxyribonucleic acid, is a long and complex molecule that contains all the information necessary for making all the proteins in our body. It is specific to each individual, being our own unique genetic code. The proteins in our body that are formed from our DNA are responsible for the absorption, distribution, metabolism, and excretion of drugs. As we all have our own set of genes, we are all genetically different, and therefore our bodies also differ in how we react to medicines. There are actually several factors that influence how the body reacts to a drug, such as age, environmental factors, diet, and our DNA. Genetic variations can contribute to 25 to 50% of inappropriate drug responses. However, most of the time, the doctor will prescribe a new medicine in a standard dose, without taking into account the genetic code of the patient. This standard dose works well for most individuals, but in others, this dose can cause unwanted side effects, or it may not work at all. Side effects are the 6th leading cause of death, causing up to 100,000 deaths annually in the United States alone. Side effects are a real problem. But what does our DNA have to do with this? During the process of making proteins from DNA, mutations can occur. A mutation is a change that occurs in our DNA sequence, which can lead to the formation of a non-functional protein. If proteins are responsible for how medicine enters our body, how it is distributed to the place where it has to exert its effect, how it is broken down, and how it is excreted afterwards, then if one of these proteins is not working properly, it can influence the response to a medication. For example, ABCB1 is a gene that encodes a protein that has a transport function and influences the distribution of some medicines. It is present in the blood-brain barrier, the barrier that controls what goes in and out of the brain. The medicine enters the brain, exerts its effect, and ABCB1 is responsible for transporting the medicine from the brain to the bloodstream so that it does not accumulate in the brain. In case there is a mutation in the ABCB1 gene that leads to a non-functional transporter, what happens is that the drug accumulates in the brain, and this can cause unwanted side effects. The SLCO1B1 gene is an example of a gene that encodes a protein with a transport function and is responsible for transporting medicines to the liver. In the liver, drugs are broken down into metabolites that are easier to eliminate. Therefore, when there are mutations in this gene that lead to the production of a non-functional transporter, the medicines are not transported to the liver to be metabolized and subsequently eliminated. They are accumulated in the body, which can result in unwanted side effects. Dopamine is a neurotransmitter that is produced, for example, in response to stress. It leaves us in an alert state. When the stress stimulus disappears, dopamine is broken down by a protein that is encoded by the COMT gene. The breakdown of dopamine is important so that we are not always in a state of alert. When the COMT gene has a mutation called MET, the protein that breaks down dopamine is not functional, and dopamine levels are higher, and therefore the person is in a state of alert. As a consequence, people with the MET variation in normal situations, that is, in the absence of stress, generally perform better in functions dependent on the prefrontal cortex. However, those same individuals with the MET variation do not react as well in stressful situations. But how do you know which variations are present in each patient? We have the test that can help you understand your patient's body and your patient's genes. Just buy the test for your practice online and get started. Now you can provide your patient with a swab and an instruction manual to collect a saliva sample. The sample is sent back to us with the return envelope. When it is sent to the lab, it will be processed and analyzed. Now, the patient only needs to wait. The results will become available in his or her account. Upon receipt of the results, the patient will get a report that is specifically written for patients and contains the full results and explanations per gene. The healthcare provider gets a report that is specifically developed with a more scientific approach to give all the background information to help the healthcare provider and patient decide what will be the best choice of medicine and dose, taking into account their unique genetic code. Start with pharmacogenetic testing in your practice and register your first test kits on meamedicapro.com.